Hello, my name is Julie Booker. I'm a licensed acupuncturist and herbalist and a fellow of the American Board of Oriental Reproductive Medicine. Today I'm going to be talking a bit about polycystic ovarian syndrome, or PCOS. PCOS is one of the most common endocrine disorders of women of reproductive age. It's estimated that around 4 to 12% of women of reproductive age have this disorder, and it has implications across the lifespan, meaning that during menarche, girls might have irregular periods, maybe a little hirsutism, which is extra hair growth where they don't want it, and a little bit of weight gain. Then, during reproductive age, we might have more profound anovulation, infertility, and we start to see the metabolic profile change to insulin resistance and glucose intolerance, and that becomes really important in treating PCOS. Once a woman passes reproductive age, the insulin resistance becomes more profound and may lead to diabetes. She's still dealing possibly with the weight gain, more stress and anxiety and depression, and that's also a common thread throughout the lifespan. Acupuncture and Oriental medicine are profound tools to treat this, because not only can we treat the symptoms like insulin resistance and anovulation, but we treat the person as a whole. We treat the root of the disease instead of the branches. We can help regulate the hormones, we can help with ovulation and the insulin resistance, but really the important thing is we're treating the whole person. Nutrition is also a big aspect for this population, and TCM always focuses on a whole foods diet, but because of the metabolic profile of the person, insulin resistance and glucose intolerance, you really have to focus on a low GI diet. So good fats, protein, vegetables, and foods with a lower GI content. Exercise is really important for women with PCOS. PCOS affects women of all shapes and sizes, so you don't necessarily have to be overweight to do the exercise. When you exercise, it builds muscle, which helps insulin sensitivity, which is a big deal for this population. Also, it helps with the cortisol. The cortisol is that stress hormone, and we're going to see that women with PCOS have more profound psychological issues like depression, anxiety, and stress. So we really have to address that too. You can address the psychological well-being of a person through acupuncture, herbs, certain supplements, things like that. Among the lifestyle changes are toxins as well. Toxins are incredibly prolific in our society, and they are endocrine disruptors. And because women with PCOS already have endocrine disruption, this is really important. Women with PCOS have higher rates of BPA in their systems. So if we can reduce the phthalate and the BPA load of these women, we are doing them a great service. So in all, to address the psychological well-being, lifestyle changes in diet and toxicity, and using acupuncture and herbs, we can really treat the whole person and get them in wonderful reproductive health.